heart's this big. How about yours? The Shawnee Mission Medical Center team is showing its support for the American Heart Association and Go Red for Women all month long. Also, robots are taking over the hospital. Celebrating 10 years, the hospital's robotics program has added another robot and continues to help patients get back to life sooner. Your Shawnee Mission Medical Center news starts now. Hello everyone, I'm Chris Olson. This is your Shawnee Mission Medical Center update for the week of February 13th. Have you been wondering who those strange-looking people are lurking in the hallways? As a major sponsor of the American Heart Association and the American Heart Walk, Shawnee Mission Medical Center is devoting all of February to Heart Health Month. On National Wear Red Day, associates were encouraged to wear red and stop by the Garden Cafe to purchase a paper heart. Associates could also send a thank you gram to a fellow associate, family member, or friend. Proceeds will go toward Shawnee Mission Medical Center's $40,000 Heart Walk fundraising goal. The theme of this year's Heart Month campaign is taking steps toward a healthier heart.
We believe that with the awareness that 600,000 people a year die from heart disease, the more that we can make our associates, our patients, our visitors who come to Shawnee Mission aware that there are ways to prevent and reduce those risks of heart disease, then we're helping to fulfill the mission of Shawnee Mission and the American Heart Association.
As for the mannequins hanging around the hallways, stop and have a quick read. Each one is fitted with a fancy outfit and a heart health tip. February is also Black History Month. We're celebrating some of the medical field's greatest thinkers, both past and present. Mary Elizabeth Mahoney was the first African American to study and work as a professionally trained nurse in the United States. She graduated in 1879. Dr. Charles Drew was an African American physician, surgeon, and medical researcher. His most famous research was in the field of blood transfusions, where he developed improved techniques for blood storage, applying his expert knowledge to developing large-scale blood banks early in World War II. The American Red Cross blood program of today is a direct result of the work of this medical pioneer. And Dr. Benjamin Carson, who is an American neurosurgeon and currently the director of pediatric neurosurgery at Johns Hopkins Hospital. He was awarded the Presidential Medal of Freedom, the highest civilian award, by President George W. Bush in 2008.
We're a pretty diverse community, and it's important to share our diversity and value each other. And so we're trying to communicate some of the important contributions that African Americans have made to the medical community and to the health of our society.
10 years ago, Shawnee Mission Medical Center committed to making surgical robotics a priority. Now the hospital has 2 Da Vinci surgical robots and has performed 1,200 procedures and counting. Robots, not those of the likes of Short Circuit's fame, but ones that make beautiful music in the operating room.
The robotic instrumentation allows us to do surgery with the kind of precision that you think all surgery should be done with. It allows us to see things better, we can magnify them better, and we have more precise tools in order to do our operation.
Dr. David Emmett, a surgeon who has been using robotic surgery techniques for the past 10 years and serves as the director of Shawnee Mission Medical Center's Shull Institute for Surgical Robotics, says he could easily see the world of surgery changing with the addition of more robots.
When we were doing open surgery, our average hospital length of stay was 3 to 3.5, 4 days. Our average blood loss was 500 to 800 cc's. Our patients were going home with a catheter that stayed in for 2 weeks. There were some occasional complications, but we were pretty proud of how we were doing that operation. With the robotic surgery, it's unusual for a patient to not go home the day after surgery. Our average blood loss is between 100 and 150 cc's, which means that the risk of needing a transfusion is probably less than 0.5%. Our patients have a catheter for 1 week instead of 2 weeks. They're able to recover to resume many of their normal activities much sooner than they could with the open surgery.
Currently, Shawnee Mission Medical Center has 2 surgical robots and has performed 1,200 operations and counting.
Within a week, I was back at my desk working.
Chris Rogers was one of those patients. This most recent operation was Rogers' 6th at Shawnee Mission. His previous 5, 2 eye surgeries, a shoulder surgery, and a hip replacement. And had it not been for robotic surgery, his most recent would have been his most intrusive.
Easiest, quickest recovery of any of them. Some of those were pretty intrusive surgeries. And a prostate removal is by nature very intrusive, but done robotic assisted like this, it's just, it doesn't have that impact. Day-to-day impact after surgery is far less.
Instead of bed rest and complications, Rogers was up and moving within a few days, and as he said, back to work in a week.
I would expect with a little more, as the numbers come up and more of them are done, it may become outpatient surgery. I felt that good that fast.
If you are interested in learning a little bit more about our surgical robotics program, call the Ask a Nurse Resource Center or visit shawneemission.org/surgical robotics. One of the Shawnee Mission Medical Center gyms is Sante Image Renewal Boutique and Salon. Sante opened in 2010 and has helped hundreds of women regain their confidence and live healthy lives. Be it a life-changing illness or the desire to live and look healthy, Sante helps women keep their beautiful image. Sante carries wigs and is a licensed salon, breast forms and bras, natural hair care and makeup products. Sante even has private fitting rooms for women who need help with post-mastectomy products.
We're here to help people that have gone through physical, medical challenges. So whether it be cancer, it might be somebody who has rosacea and needs help with skincare and makeup.
We carry products that are vegan, gluten-free, sulfate-free, paraben-free, those things that have been linked to cancer, and where studies have shown that there may be a link to other kinds of illnesses. So that's really important to us as well.
Sante is open to the public and runs specials each month. February's promotion, hand and nail specials. We will be ending every week featuring Creation Health, which is a life-transforming approach to total person wellness.
Creation Health fits right in to our philosophy, but it's also about empowering our patients and our community and our associates to take responsibility for their health.
Each month, the Associate Wellness Program focuses on a different wellness initiative to better associates' health. January was to drink water, and February is to take the stairs. If you would like to take a class on Creation Health, call the Ask a Nurse Resource Center 913-676-7777 or visit shawneemission.org/creationhealth. Thanks for joining us for SMMC News, where you can find out what's happening around Shawnee Mission Medical Center. Hope to see you next time. I'm Chris Olson. Have a fantastic week.